Hello, my name is Greg Hudson. I am a psychiatric nurse practitioner and current doctoral student at Seattle University. I wanted to thank you for your participation in this research on establishing a brief and practical screening tool to identify harmful sibling aggression in pediatric primary care. This research is part of my Doctor of Nursing Practice degree at Seattle University, and I estimate your participation today should be no more than 20 to 30 minutes, including this 15-minute presentation. So let's get started. My committee members are listed here. Dr. Bonnie Bowie is my chair. Dr. Janice DeSocio is my reader. Both are faculty at Seattle University. My clinical preceptor is Dr. Ginny Bucola at Greater Lakes Mental Health in Lakewood, Washington. And a bit about the survey to follow this. I will be collecting just some basic demographic information from pediatric primary care providers. If you'd like follow-up, please provide your name and email in the survey to follow, but that is optional. I will not be collecting any patient data, nor do I have any financial gains to disclose. So this is the problem statement that this research is focused on. Despite sibling violence being the most widely prevalent type of family violence and a growing body of evidence on negative outcomes, there is no standardized screening process that is commonly utilized in pediatric primary care to screen for the presence of harmful sibling violence or aggression. So a brief lit review on sibling violence. Sibling violence is the most common type of household violence in America. This was first established by Strauss and his colleagues in 1980 during a national violence assessment across the United States. Every state participated, and this was again replicated in 1990 with the same finding that sibling violence or sibling aggression was the most common type of violence, and again in 2005. So 82% of American children engage in sibling violence each year. About 54% of this results in physical injury towards one or both of the children. If we extrapolate this out, we can estimate about 50 million children engage in sibling violence annually. And we can compare this to about 10 million Americans engaging in partner violence annually, partner violence being the second most common type of family violence or household violence in America. I also wanted to acknowledge a normalization of sibling violence or sibling aggression in American culture. You could compare, for example, two types of bullying behaviors at the school and at home. And it's been shown in research that when the same act, such as a push on the playground, happens between peers at school, it's widely considered bullying behavior and more often is suggested for an intervention. However, when this same behavior occurs between siblings, it's much more normalized. And that's a rather mild example, but this has been found to extrapolate out amongst different types of violence or different levels of violence between siblings as well. There's also significant links to negative outcomes with sibling violence. 83% of children who experience severe or prolonged sibling violence and aggression report long-term negative effects. Typically, these include anxiety, substance abuse, eating disorders, depression, and post-traumatic stress disorder. We also see in the research that increased rates siblings that engage in sibling violence have increased rates of domestic and dating violence later on into adulthood. The theory being that if your language with your loved one involves violence, then such growing up with a sibling, this is more likely to continue with other intimate relationships into adulthood. There's also good research emerging on protective factors for sibling violence. This research through Howell and Miller-Gaff in 2014 found that the presence of one strong protective factor can mitigate different traumas related to sibling violence. They identified 4 significant protective factors, such as a stable parenting relationship, strong spiritual supports, regular counseling, and also a supportive peer group. And so I'm sure many of you are thinking either about some of your own clients or patients that have experienced sibling violence, or maybe even your own children or your siblings growing up and the type of violence or rivalry that you engaged in. And so I really want to distinguish between what can be described as healthy sibling rivalry and harmful sibling violence or aggression. Now, so sibling rivalry is more defined as the conflict between siblings that can strengthen and empower relationships and social learning. So, because we know that conflict is a natural part of life, it's a part of growing up and learning how to help deal with conflict in a healthy and productive way. And so this type of conflict is actually considered constructive for social development, especially within the confines of safety and safe relationships in the family. Now, without those safe protective factors, sibling rivalry can escalate into sibling violence or aggression, which, for the purpose of this study, is defined as a repeated or escalating pattern of physical aggression that aims to harm or leave the other feeling humiliated or defeated. It is unsafe in its basis and is often defined by role rigidity, meaning that one sibling is typically the offender and the other typically the victim. So for the purpose of this screening tool, we are trying to distinguish what is harmful sibling violence or aggression that warrants further exploration or possible referral for mental health counseling or treatment. And as I said, there's a growing body of evidence on the effects of sibling violence and aggression, particularly in America. Here I have listed a number of studies that, through their research, have suggested the implementation of early screening and assessment for sibling aggression and violence, particularly in pediatric primary care, in order to prevent some of the more long-term effects that I discussed earlier in the presentation. Which leads us to the goal of this project, which aims to develop and assess the utility of a brief screening tool for the presence of problematic sibling violence and aggression during the pediatric well-child exam. So these questions that have been designed are directed at the child, refined through expert content analysis of both psychiatric and pediatric providers, both are in clinical practice for use in pediatric primary care. So let me take a moment to cover the theoretical basis for this tool. As I said earlier, there's currently no screening tools for what I've been discussing as problematic sibling violence. So I looked towards the development of intimate partner violence screening tools for the basis of this screening tool. There's very good tools for use or used currently to screen for intimate partner violence, particularly in emergency rooms and primary care. The two most common tools are the HITS and the PVS, listed in the middle of the slide here. And we've come to know these questions over the past 2 decades as fairly normative or normal screening questions, such as, do you feel safe at home? And so the way that these tools were developed was a couple of questions, or a few questions were developed from the literature and then presented to an expert group of clinicians with very good clinical experience for refinement, and then later went through psychometric screening. So this is the process that I've adopted for the development of this screening tool. These questions that I will present in a few slides were developed from the Juvenile Victimization Questionnaire, the Conflict Tactics Scale, and the Trauma Symptoms Checklist for young children, all of which I have referenced at the end of this presentation. I also want to take a moment to discuss the importance of child self-reports, as these questions are directed at the child. Research shows that parents and caretakers often misinterpret a child's emotional state, which can be very different from their lived experience. And children as young as 5.5 years old can provide very reliable and valid measures of emotion during an oral interview, such as the one that takes place during the pediatric well child exam. And so the goals of this screening tool are to be easy to understand. It's directed at children between the ages of 5 and 12 years old. I want it to be simple to administer during a well child exam. Again, the questions are directed towards the child for a primary source response, and they're designed to be asked toward the end of the exam when rapport has been built with the child and the family members that are present, or when there's a specific indication during another part of the assessment that there has been some type of physical or mental abuse by the sibling. And so that leads us to the screening questions here. It's strongly recommended that there's a lead-in statement such as, "Now I'd like to ask you a couple questions about life at home with your brothers or sisters." Sometimes brothers or sisters hit, bite, or kick each other when they are feeling mad or frustrated. Does this happen to you with your brothers or sisters? And if the child answers in the affirmative, asking a brief follow-up question such as, "How often does that happen?" And it might be helpful, especially with young children, to help them quantify, like such as, "Does this happen every day, every week, or just sometimes?" And then following up with an open-ended question such as, "Tell me about that." So we know from the demographic data that many children will answer in the affirmative to this because many children experience sibling violence or aggression, which leads us to the second question to further screen for harmful sibling aggression. And this question was broken up into two parts based on the age of the child. So for a child ages 5 to 7 years old, it's asked that some kids say it's scary when they fight with their brothers or sisters. Have you ever felt like you or your body might get hurt very bad when fighting with your brother or sister? And for children ages 8 to 12 years old, some kids say it's scary when they fight with their brothers or sisters. Have you ever felt afraid for your life when you fight with your brothers or sisters? Again, if the child answers in the affirmative, asking how often, and helping them to quantify, such as, do you feel scared a lot or every day or just sometimes? And if there's an affirmative for this, asking, can you ask them to stop, or can you escape when this happens? And further inquiring about protective factors that such as that stable parenting relationship, strong spiritual support, if maybe the child is already in regular counseling or has a supportive peer group. So with the affirmative of these questions and the lack of protective factors, it's strongly recommended that a referral take place. And so those are the basic screening questions. Again, it's not meant to be a comprehensive exam or cover of violence, but simply a brief screen to establish if there is a referral that is necessary. And these are the follow-up recommendations suggested from the team of psychiatric providers that reviewed these questions earlier in this project. Their recommendations were a brief safety planning session in the appointment with the caregiver that was present before ending the appointment to establish some type of brief safety plan and intervention for when the child feels unsafe at home with this sibling. A referral to a specific social work or counseling agency for follow-up on this sibling violence and aggression that's occurring. As well as a follow-up exam scheduled within 12 weeks with that primary care provider to establish if that referral has been completed. And then of course we have to mention the CPS referral in the most extreme cases of physical harm. As stated earlier, this is not meant to be a comprehensive assessment of violence or sibling aggression, just simply a screening tool to see if additional care is needed for that child. However, I encourage every provider to fall back on their training if they see this type of extreme case and make the referral if and when necessary. And these are those references I mentioned for anyone who would like to follow up with more information. You may also please contact me if you would like any additional information on my sources. And again, here are those questions that I'm proposing for this screening tool. I very much look forward to hearing your feedback on what you think, if these questions are child-friendly and appropriate for your well child exam. I think this is an important type of violence that's being missed right now in our society, and I would very much like to hear how you think we can better screen for the most common type of violence that children experience. So please follow the link to the survey in the email and provide any information. Again, I will only be asking for your credentials, and if you would like to follow up and possibly pilot this study, I'd encourage you to leave your name and email, and I will follow up with you. Thank you very much for participating, and I look forward to your response.